welcome to Afternoon Express. It's another motivational Monday in the loft. I'm Bonnie Booley.
Yes. I'm Bonang Matiba. Thank you so much for joining us. Yes, we're back. Another hour of inspiration right here live on SABC3. And today we're going to be chatting about a very serious yet underdiagnosed condition, diabetes.
Yeah. An estimated 6% of South Africa's population is living with diabetes, and many more are undiagnosed. So we've invited some experts in the diabetes field to help us demystify the condition.
Absolutely. First up, we're going to be chatting to a clinical nurse who's going to give us the exact breakdown of what diabetes is, so stick around for that.
Yeah, we've also invited a celebrity chef and nutritionist, Vickie de Beer, to teach us a diabetes-friendly dish.
Fantastic. So make sure you stick around, sit back and relax. We are live. We do love hearing from you, love interacting with you. We are on Twitter. Use our official hashtag Afternoon Express at Afternoon Chat on Facebook and Instagram. And of course, you can call us, but I'm not going to give you the details. It's not just me and Bomb Bizzle in the loft. Jay Dizzle is in the kitchen. How you doing, Boo?
And of course, the ladies are looking so glorious and elegant and black. In fact, it's because they're mourning the weekend. Welcome, I'm Jeannie D, and I trust that you had a wonderful weekend. But we are here on Monday, and I love being in the kitchen on a Monday because, well, Mondays always start a little bit slowly for me. So at least today we're going to learn how to cook something really delicious. Today, my lesson is in making a pork shoulder, I believe.
And learning all about maple syrup. The beautiful flavor pairing. So pork shoulder, maple syrup and apple bun. So put it all together and just crunch on it. It's going to be so delicious.
Well, this already resembles my breakfast. I do the cayenne pepper, maple syrup and lemon juice every single morning.
Not so much pork shoulder.
Very healthy. Can't go wrong with that. So cook with us today. All you need to do is visit our website, afternoonexpress.co.za, where you can get all of our recipes and you can follow us as we cook for you this afternoon. And of course, give us a call on 083 913 3728 and chat with us a little bit later, especially if you've got any questions or comments for any of our guests. But for now, Bonnie's on the couch with our very first guest.
Thank you, Jeannie. According to the International Diabetes Foundation, in 2007, 366 million people had diabetes globally, and this number will rise to 552 million by 2030. The greatest increase in diabetes is expected to be in Africa. It's predicted that the incidence of diabetes in Africa will have almost doubled by 2030. There are currently 14.7 million diabetics in Africa. However, according to the IDF, around 78% of Africans with diabetes are undiagnosed. And in SA alone, 3.5 million South Africans, about 6% of the population, suffer from diabetes, and there are many more who are undiagnosed. It is estimated that another 5 million South Africans have pre-diabetes, a condition where insulin resistance causes blood glucose levels to be higher than normal, but not high enough yet to be type 2 diabetes. Are you at risk? Let's first find out exactly what diabetes is and how this condition works. With us is expert diabetes nurse with more than 40 years of experience, Lynn Stark. Welcome to the loft, Lynn.
Welcome. Thank you for inviting me.
Thank you. Lovely to have you. So, Lynn, a lot of people out there don't know what diabetes is and how one gets it and why.
Diabetes is a condition of carbohydrate metabolism. In other words, they can't utilize sugar properly. And there are many different kinds of diabetes, the most common being type 2 diabetes, which you have talked about. But type 1 diabetes specifically occurs in the young. And there are very young children, and that is due to a lack of insulin. They cannot make any insulin.
Right.
So they are required to take insulin by injection. Then the type 2 diabetes is occurring in children. Because of our lifestyle.
Right.
Children are sitting watching TV, they are not exercising, they're eating badly. So type 2 diabetes is actually frighteningly on the increase worldwide.
Oh, wow.
And unfortunately, due to childhood obesity, and also they come with a lot of the troubles already, with even as young as they are, they could have high blood pressure already. That is a condition of not lack of insulin, but a condition of insulin resistance.
Wow.
In other words, they can't, the insulin is there, but because of the obesity and the other problems, it's almost like a blocked drain. The insulin can't move into the cells.
Okay.
And they are also prone to the complications of type 2 diabetes.
Right.
And then there is a third one, there are a few more, but the one that we probably talk about most of is what we call gestational diabetes, which occurs in pregnant women.
Wow.
And it can occur just during the pregnancy, and then can go away and may recur later, but may disappear completely.
Right.
That is the only diabetes that kind of comes and goes, or can come and go.
Yeah.
The others are there basically for life.
Now, symptomatically, how does type 1 diabetes and type 2 differ in how they manifest themselves in the body?
Type 1 diabetes occurs in the young, usually before the age of 30. They are thin, they are usually healthy, and they start drinking a lot of water. Sometimes the child will start wetting the bed if they have been dry before. Sure. They lose a lot of weight very quickly. They often present with quite severe abdominal pain, and they can vomit. And it's a condition, it can be a very serious condition. It can be life-threatening if it's undetected. So that is because, and it is quite quick on onset, usually within 2 weeks to about a month, you'll notice the symptoms. Oh, wow. It can occur in very young children, even as young as 6, 7 months old. It is rare in that age, but it is on the increase worldwide.
On the increase.
Yeah.
What are the links between HIV, diabetes, and TB?
They are, with the HIV epidemic at the moment, because it is an what we call an autoimmune disease, people with HIV are prone to get diabetes, but they would get what they call a secondary diabetes due to their immune system being compromised.
Yes.
TB, because a patient with diabetes is immunocompromised, or that usually they don't have such a good immunity, so TB is very common in patients with diabetes, because they can pick these things up very quickly. But if patients are very well controlled and given good medical care, then we can try and avoid these diseases.
Right.
Also, with TB, cough and TB is the first presenting factor.
Okay.
And then they can get their diabetes. So that can happen that way around as well.
Right. And why is it important for us to watch our weight and keep our weight down and watch our sugar intake? Type 1 diabetes is not related to how much sugar you eat, but type 2 diabetes certainly is a lifestyle condition. It is hereditary, or if you have parents or grandparents, the chances of you getting diabetes are very high. And there is a prevention in that if you keep your weight down, you exercise well, and you eat the correct foods, you can either prevent it or you can delay its onset. Right.
So that is why it's important. And also, basically, you need to keep your weight down to be healthy.
To be healthy,
yes,
yeah. Thank you so much, Lynn. But you're not going away. We're going to expand on this a little bit later.
All right, thank you.
After the break, Jeannie makes us a pork shoulder, maple and apple rolls, and we chat to food editor Vickie de Beer about the do's and don'ts of nutrition when living with diabetes. Remember, we are live, so if you have any questions or comments, then call us on 083 913 3728. We'll be right back. Don't go away.
Clicks. Feel good. Pay less.
Welcome back to Afternoon Express, and we're about to get cooking in the kitchen. Remember, you can join us by visiting our website, afternoonexpress.co.za, and our shopping list, and as well as the recipe, is on the website. Now, we're going to get cooking. What do you want me to get started with? Because you know I'm such a pro
First of all,
in the
let me sort
kitchen.
of paint the picture for you. So we're going to have a beautiful toasted bun. And we're going to have this yummy, delicious pork shoulder roast that has a salted caramel, then apples, and then a little bit of pickle, and then this beautiful dressing that you're going to make. So it's basically all what we're doing here is all about maple syrup. This fabulous, beautiful, delicious syrup and stunning flavor pairing. So a lot of the time you don't really know what to do with maple syrup besides pour it over your pancakes. This is a great, great idea on what else to do with maple syrup and what else to pair it with, like apples.
Perfect. And maple syrup is, I mean, there's such huge buzzwords going around at the moment about maple syrup.
So, I mean, it's not, you know, it doesn't originate from South Africa, but it's one of those things that come from an origin. You can only get it from a place like Canada. So Canada creates something like 80% of the world's maple syrup, tapped from a tree. I mean, how beautiful and organic and natural is that? Literally, pop a tap into a tree and off you go. So that you then drain the sap from the tree, and then that's then boiled down a lot. It takes something like 40 liters of the maple sap to make 1 liter of maple syrup. So this is beautiful and golden. You need to treasure
this
it
really
and
is
use
gold.
it wisely.
Okay, how am I going to get started?
Okay, so this is going to be effectively the sauce for your bun. So take away your tomato sauce and your mustards and whatnot. This is a glamorous mustard. So a bit of Dijon mustard, about 2 tablespoons of that. Glug in some of the maple syrup. Taste it. Like taste what? Like do you like it kind of sweet, a bit more tangy from the mustard?
How's that?
Yeah. And
You
then
said tablespoons, I use teaspoons and just like made them quite heated.
So sort of glug in a little bit of the maple syrup, give it a taste, and then squeeze a little bit of lemon juice. You know, there are obviously measurements that you can follow for a sauce like this, but taste it, taste it. It's your taste buds. You're going to know how sweet and savoury and lemony and...
Well, you're trusting me here because I'm just throwing in. But luckily, I have a flair for the kitchen. So.
Okay, so apples. So this is going to be the crunch in your bun. It's a bit strange to put like fresh apples in your bun, but what we're going to do is use this fabulous mandolin and cut thin slices so that you don't end up like crunching on big, chunks of apple. Quite simply, be very careful. This is very sharp. I've just sort of taken off the bottom here to make it easier to hold, and you just slice like that. Beautiful little slices like that, pop out. And that's going to go into the bun. Just slice those through. You can use whatever apples you want. I'm using green apples just because they're full of flavour and they really pair well with the pork. Don't be scared of the little pips. You can just kind of pick them out and chuck them away. And that's going to go inside of our bun. So to prevent this from going brown, because we are only going to use them later, I've got a whole bunch of lemon juice just squeezed into some water, and you plop that in there, and that's going to keep it from oxidizing and getting that brown nasty layer. And then this quite simply goes into the oven. We just take it right out, and the salted caramel, the apple, the maple syrup, the mustard, like I said, it's all about flavor pairing. It's just sitting and thinking about what really works well on a bun. You can put anything on there. You can literally put anything on it, but I think this flavor pairing is beautiful, absolutely beautiful. This goes into the oven, and then we're going to add that, just slice it up onto our bun later, and that's really it.
Okay, excellent. Recipes on our website, afternoonexpress.co.za. When we return, or when you see us back in the kitchen, hopefully that would have glazed and cooked a little bit better, and we'll get ready. We'll carry on with the recipe. But for now, we have Bonang on the couch with our next guest.
Thank you so much, Jeannie. That looks absolutely delicious. Now, food editor and co-author of the Low Carb Solution for Diabetics cookbook, Vickie de Beer, joins us in the loft to educate us about eating healthy when you are diabetic and to ensure you don't develop diabetes. With her is Diabetes SA facilitator and mentor, Carol Hendricks, who also lives with diabetes type 2. Welcome, ladies. Lovely to have you in the loft. Now, Vickie, I'm going to start straight with you. What are some of the do's and don'ts when it comes to nutrition and living with diabetes?
Well, my son Luca was diagnosed with diabetes when he was 8 years old, and for many years we did the low GI way of eating, and it's only the past 2 years that we've been doing low carb for diabetes, and it has been very successful. So the book is also about cooking low carb, and that basically means that we cut out all fine starches like rice, potatoes, bread, pasta, all of that. We don't eat that anymore.
Wow. So, I mean, why then is sugar so dangerous for people with diabetes?
Because the sugar that goes directly into your bloodstream, it is sugar or carbohydrates. All carbohydrates are turned into glucose in your bloodstream, and it causes your sugar to spike. It causes highs. And then also, after that, the lows. So that's the awful feeling when you feel during a day, when you're getting tired and feeling lethargic. It's all the ups and the downs. And it's not just because diabetics get it. It's also with us. If we eat too much sugar, we get exactly the same effect.
All right, so that's what it is.
Yes.
Okay, now let's move then to, type 2 diabetes. We hear it's, it develops in people who have had very unhealthy eating habits, who've consumed a lot of sugar throughout their lifetime. Is that true or false? And then how do we prevent it from developing into type 2 diabetes?
I don't think that's exactly true. I think there's a lot of factors that come into play, not just eating a lot of sugar. I think it's a whole lifestyle choice that you make throughout your life, exercise and the types of food that you decide, also a predisposition to diabetes that you must have already. But basically, I know that if you start eating low carb and really cut back on carbohydrates, you can reverse a lot of the bad, things that diabetes cause in diabetics 2, and it is reversible. That's the great thing. Whereas with diabetes 1, you will always need insulin. You must always get insulin. You cannot make your own insulin. So with diabetes 2, this is a very effective way to change your life.
All right. And somebody who has changed her life is Carol. I mean, Carol, you work every day with young children and women who are, first of all, uninformed, you know, who are living with obesity. And you were overweight as well.
Yes.
And that's when you were diagnosed with, you know, type 2 diabetes.
Type 2.
Tell me a little bit more about your personal journey.
I had to look after my mother who had diabetes, and I knew nothing. Wow. So I went to a doctor and said, look, I know nothing about diabetes. Please inform me. And he gave me some tips and told me about diabetes, some knowledge. And I live in Mitchell's Plain, and I came across people that knew nothing about diabetes, and it was a very big concern. So I wanted to tell them the dangers around diabetes. You cannot have diabetes and not use your medication, because that is the key to your health. So I came across Margot at Diabetes South Africa, and she asked me, can I please start a support group in Mitchell's Plain? And I first didn't want to do it, but afterwards I started. And then I started going on workshops. Margot gave us workshops at Diabetes South Africa. And from there, that is 15 years ago, I'm still going strong.
That's fantastic. But Carol, you know, right, in South Africa, there's a very big cultural belief in that when you're overweight, you are rich, you are wealthy. So how then do you change people's mindsets in order for them to change their lifestyles?
You see, to change their mindset is to say, eating wrong is wrong totally. You end up being obese, you end up with all these diseases like diabetes. And it's not that you are obese, you have diabetes. You can be thin and also have diabetes.
True.
You see, so, but with a type 2, it's normally more the overweight people.
Yeah.
So that is where I got on my journey. I'm mostly with adults, and it was very much my concern. But I changed most of their lifestyles. Not all of them, because you can't.
You can't.
But those that my support group members, I started with 13. I'm looking after almost 120 people. So yeah, I changed a lot of lives already.
That's incredible.
Even saved lives already.
That's
by just telling them what to do when you're in a high or when you're in a low.
Yeah, but as a facilitator at Diabetes SA, how does your normal day-to-day look like every single day? What do you do?
You know, every single day, I was asked a question earlier on, is it a full-time job?
Yeah.
Yes, 24 hours a
Wow.
day. You counsel, you speak to people, you give them knowledge, because every day you come across diabetics that's not even using their medication. They think it's not necessary, but that is the key to their health.
Yeah, and I mean, that's very dangerous, right, Vickie? Obviously, you have to change your lifestyle. You have to change what you're eating. You have to take your medication. But with what you're eating, does it mean that you have to cut out on all the yummy goods, the things that you love? You know, the sweets, the sweets, probably.
Yeah,
like the
you should
desserts.
definitely reduce the sugar, yes. But, you know, we've developed many recipes without sugar, and using things like almond flour and flaxseed and xylitol, which is delicious. It's still, we eat very, very, very delicious. You know, it's not the end of the road for that. We don't. So definitely, you can still eat delicious food, but just more healthy.
Fantastic. And talking about delicious food, you and I are going to make something very, very delicious after the break. But if you want to attend the launch and lifestyle event this Friday in Franschhoek for Vickie's The Low Carb Solution for Diabetics, as well as your own copy of this book, here it is. All you need to do is SMS the keyword Express, your name and city, to 33728, and you could win a set of 2 tickets worth 375 Rand, each along with a copy of the book, all right? Do remember that SMSs will cost you R1.50. T's and C's apply and are available on our website, afternoonexpress.co.za. Like we said, Vickie and I are going to make something very, very delicious after the break, so stay right where you are.
Give kids the gift of hearing this Christmas. Are you with us?
Welcome back. You're live on Afternoon Express right here on SABC3. In case you just tuned in, it is a Motivational Monday, and today we're talking all things diabetes. And we're back in the kitchen with Vickie, who's the co-author of this incredible book, The Low Carb Solution for Diabetes. And today we're making some delicious almond and yogurt flapjacks.
Yes.
Sounds divine. I was asking you earlier on, you know, when you are diabetic, type 1 or type 2, does it mean you cut out on all the yummy stuff? You said no. So what do we need, Vickie?
Okay, so firstly, what we're going to use instead of flour is we're going to use almond flour, which is just basically ground almonds. We're using 500 milliliters of that. And it's basically the base for the recipe, and it is low carb.
Yum.
With that, I'm adding some baking powder and some cinnamon. And I'm just going to mix that in this bowl. And on this side, I'm going to do the wet ingredients, which is half a cup of full-fat yogurt.
That looks delicious. Okay.
With some xylitol. It's about, you're depending on taste, but I prefer not to use too much xylitol as it is an alcohol sugar and it's not so good for you.
I was about to ask for anybody that's watching that doesn't know what xylitol is.
Yes,
you just explained it.
It is a sugar substitute, and as with all sugar substitutes, you shouldn't take too much of it in.
Just, all right, and 2 eggs?
2 eggs goes in there as well.
Do you need me to help you with something?
Can you stir that up for us?
I will stir that up for you.
And as soon as that is broken up, we can just add it. Like with anything, when you try to mix dry ingredients and wet ingredients, it's always good to make a little well in the center.
Yes.
And then pour the wet ingredients in there, and it will just make mixing it so much easier.
This full-fat yogurt makes it quite tricky, eh?
Yes, it does.
Jeez.
But it's fine. It will mix.
Is that enough for you?
That's perfect. Thank you. Well done. Okay, so I'm going to pour it into the almond flour. If you're allergic to nuts, you can also use coconut flour, which is also a low-carb flour that works very well. Coconut flour just tends to use more moisture, more liquid, so you will probably add maybe a drop of milk or even water if you want to.
Fantastic. Now, Vickie, are these some of the recipes, of course, that we can find in this incredible cookbook?
Yes, yes.
What inspired this book? I didn't forget to ask you earlier on, actually.
Well, Luca, my son struggled with his diabetes, and although we controlled it very well for quite a few years, we always had highs and lows, and I could see that he was struggling, so we decided to move over to low carb, and it's made a huge difference in his life, really.
Fantastic. Well, you're definitely Mom of the Year.
Wow! I haven't won that one.
What's next?
Okay, so now we're just going to fry it. You know, it's better to work on a non-stick pan. And then what I like to do is just melt a little bit of butter. You can also use coconut oil because that's also very healthy to use. Olive oil just doesn't give it the same colour. So I prefer butter.
For me, you know, knowing how much of the dough to put on the frying pan
just
is always so
it is
tricky, so I just don't do it at all.
No, you must. Did you see we mixed it in literally 30 seconds?
That was very quick.
Yeah,
great for breakfast, for a quick snack.
Absolutely. We do it sometimes for lunch, after school. It's very quick. So the pan isn't too hot, otherwise they will burn. So it's literally a little scoop of the batter that I'm going to put in the pan. We can do 2 at a time in this tiny little pan that we have. Now, the secret is to just let it lie there.
Of course, and because this is magic, it's television, this is how they look.
Yes, so they've been baked. The important thing is that if you try to turn them too quickly, they will fall apart. So you leave them until you see tiny bubbles appearing, and only then do you attempt to turn them. And that's the secret of good flapjacks.
All right, well, we don't have a lot of time, so let's make this look absolutely gorgeous there.
Okay, so normally we would just serve the flapjacks with another nice dollop of
yogurt,
full cream yogurt. And then berries, because berries are very low carb, so this could be like blueberries, is a super fruit.
Yum.
Or you could maybe use raspberries, whatever you have.
You make it look so easy. Vic, Mom of the Year. There you go. If you want, of course, the recipe and how to make this delicious almond and yogurt flapjacks, all you need to do is log on to our website, afternoonexpress.co.za. And don't forget, we are giving away a copy of this incredible book, all right? The Low Carb Solution for Diabetics. Get SMSing. But right now, let's cross over to the lounge with Bomb Bizzle and Jay Dizzle. Take it away.
Despite the fact that he's only in his mid-20s and has been living with type 1 diabetes for 10 years, where he has to inject himself 4 times a day, he has chosen to turn his situation around and use his condition to educate and improve the lives of others. As spokesperson of Diabetes SA and president of the Young Leaders in Diabetes at the International Diabetes Federation, he's passionate about breaking the stigma about diabetes.
Joining us in the loft is Keegan Hall, as well as the editor of Sweet Life magazine, author and type 1 diabetic herself, Bridget McNulty. Welcome to the loft.
Thanks for having us.
Bridget, it was only a few years ago that, I think 3 years ago, where you were rushed to ICU.
8 years ago. Let me stop you. Thanks for the compliment.
8
Not
years
quite
ago.
that young.
But that's also quite young to have been diagnosed.
Yeah, so for type 1 diabetes, I was diagnosed when I was 25. It's actually quite old. As Lynn said earlier, it's often when they're very
With
young.
children,
Which I think was very helpful, actually. My diagnosis was very dramatic. I was 3 days away from a coma, didn't know any of the symptoms. Had I met Lynn then, I would have known what they were to look for. But being diagnosed at 25, I think, makes it easier to deal with because you're an adult and you can kind of come to terms with the condition.
Exactly, but it's not like you go to the doctor and they tell you, okay, you've got flu. Like you literally were rushed in and they said, this is now very dangerous. What were those symptoms that you were perhaps ignoring?
So I like to simplify things as much as possible. In the magazine and also just any time I speak to people, there are 5 symptoms that are warning bells for diabetes, and it's extreme thirst, extreme hunger, exhaustion, needing to pee a lot, and always, wait, what's the 5th? Extreme thirst, extreme hunger, needing to pee a lot, and blurry vision. And that's type 1 and type 2, they often present with the same symptoms, and I had all of those and all kinds of other symptoms.
Yeah.
But, you know, we live in this culture where if you put on a happy face, you can kind of get away with not feeling that great, and no one's really feeling well.
But also,
Everyone's
those aren't
tired.
bad sick, you know, because often in the day you feel a little bit thirsty or a little bit hungry.
And if you drink too much water, you won't pee a lot.
Exactly.
And you've been living with this condition for 10 years now. Why is there such a severe stigma attached to type 1 diabetes?
Well, I would say in the sense of stigma, it's not just type 1 diabetes, it's diabetes in general. That's the problem. And Lynn did a great job in identifying and disseminating the 2 different types, because they are very different. Type 1 and type 2 diabetes are very different. And the stigma around diabetes, and it was great that it was touched on earlier, is we live in a country where a culture of being overweight and, you know, indicating wealth and health and all
Opulence,
that. Exactly.
yes.
So it's really difficult to try and debunk that myth around, you know, actually we should be going the other way. Rather, you know, being healthy is wealth. If you don't have your health, you don't. So, but I've had type 1 diabetes now for 10 years. I've learned and I've experienced a lot of different things from different people around the world through my work with the International Diabetes Federation, to the point where there are kids in Pakistan and in China who you actually cannot say as a woman that you have type 1 diabetes, because that means you will not get married, because no one will want to marry you. Your family completely disown you because it's so expensive to treat diabetes in these countries. And some parents even have to make the hard decision of letting their child with type 1 diabetes die so that their other children can live.
We were chatting earlier on. You've gone from having to inject yourself 4 times. Now, available treatment has evolved, and you now wear a patch?
Yeah, I wear an insulin pump. But before that, yes, I was injecting 4 times a day.
I still do that.
And
You still inject?
5 times a day, yeah.
Wow.
So, you know, and that's the saddest part. And, you know, people always say, oh, we want a cure for diabetes. But my biggest thing is that why are we fighting for a cure when there's already treatment options that people don't have access to?
Yeah.
So people are already dying of diabetes. And insulin's been around since 1912, longer than 8 antiretrovirals. But you don't have access to it.
Why not?
Good question, Jeannie, because, you know, it's a very expensive drug. There's not many generics out on the market in order to make it, you know, affordable for people. And a lot of people with type 1, with diabetes in general, is affected in the lower middle class. Yeah. So these are people who can't afford it.
Just picking up on what you were saying earlier, with that sometimes women wouldn't be wanted in that kind of environment. But you've actually just had a child 15 months ago, and you said it is quite difficult for women to fall pregnant on diabetes. How was it different for you?
So falling pregnant is not a problem, being pregnant is not a problem with diabetes, but you have to be very, very careful the whole time. So as I was saying earlier, I inject 5 times a day now. When I was pregnant, I was injecting 7 or 8 times a day. And now I'll check my blood sugar probably 5 or 6 times a day. Then I was checking 8 to 10 times a day. You have to watch everything that you eat. You have to go and see specialists every month. It's still labelled a high-risk pregnancy, but completely possible to do. Like, my child has no complications whatsoever. Everything went very smoothly. And that's part of what we try and do with Sweet Life, our magazine, and also what Diabetes SA is trying to do, is to take away this thing of diabetes being a death sentence.
Yeah.
And when I was first diagnosed, I was sent home with all of this literature that told me about the condition, and nothing in it was positive. It said, now that you're diabetic, you're at higher risk of amputation, heart disease, liver disease, blindness. Like, essentially, your life is going to suck.
Devastating.
And nowhere did it say, or you can live a perfectly healthy, happy life.
Okay, so now you are telling people that you then decided to go on a sabbatical after you were diagnosed with diabetes, came back and then started Sweet Life magazine.
Yes, 4 years ago.
So now you're giving more positive information.
And so that's what we're trying to do, and it's a diabetes lifestyle magazine. I'm not a doctor, our team isn't doctors. We have a very strong panel of experts that we run everything by, so that everything we check, everything we print is medically accurate. But we're trying to take away that stigma, like Keegan was saying, like that idea that because you're diabetic now you're sick. We can't possibly be sick because it's a chronic condition, and so it's the rest of our lives. And it's manageable, and it's actually, once you get used to living with diabetes, it's not that bad. Like, it's a habit. It's challenging.
Thank you so much.
You have to work at it.
Thank you so much for coming to see us.
For sharing with us.
To get a finger prick blood test, it takes less than 5 minutes, and you can find out if you're diabetic. It's National Diabetes Month, so now is the time to do it.
Thank you for that.
Thank you so much.
After the break, we continue the conversation. We'll be right back.
Five Roses blends only the top 2 leaves of the finest Ceylon teas. Because nobody makes better tea than you and Five Roses.
Welcome back to Afternoon Express. We're chatting everything diabetes today on the show, and we're back on the couch with our experts, Lynn, Vickie, Bridget, Keegan, and Carol. Now, I need to ask Keegan this. I mean, with just, you know, a normal citizen, how do we raise awareness? How can we be part of letting people know and educate them, motivate them, you know, make them interested about diabetes and how to live with it?
Yeah. Well, that's a really good point, is how to make people interested in diabetes. And one thing is that on Saturday is World Diabetes Day. It's a United Nations recognized day since 2006, which was led by the International Diabetes Federation, as well as its member associations such as Diabetes South Africa. And what we really encourage people to do is to go and get screened for diabetes. As Bridget mentioned, it's literally 5 minutes, and you will, you know, that test is done. You will then be referred to if necessary. But it's a really simple way in which you can, you know, create the awareness amongst yourself and get your family members to do it too. And Diabetes South Africa is there to also provide with that extra education and places where you can go and get screened for diabetes. So.
Awesome. We do have a caller on the line.
Yes. Singh. Mrs. Singh, how are you?
Fine, thanks, and you?
Very well, thank you. Welcome to the show.
What's your question or comment, Mrs. Singh?
Okay, I'd like to find out, I have been diagnosed with insulin resistance.
Okay.
And I wanted to find out what do you need to do? Do I just need to cut down my carbs?
Your carb intake? Is that what you're asking?
Yes, does she need to cut down on her carb intake? Vickie, great question for you.
Well, I would like to direct it to the professional here.
Take it away.
Type 2 diabetes, if you start reducing your diet and reduce your weight a little bit, by cutting down on carbohydrates, try to do some moderate exercise, but do not exercise unless you've, severe exercise, unless she has been examined by a doctor. Okay. Because if you're unfit, you cannot go and exercise instant. But the first step would be to try and see a dietitian and modify the diet. And perhaps get some advice on exercise.
Right. And I mean, do you believe, Keegan, that the South African public health system is giving enough attention to diabetes? And what is the reality of accessibility to education around diabetes and medication in, say, rural areas?
Yeah.
So, I mean, that is the biggest issue, is the accessibility to the medication. Because it's here, we have it in the country, we just don't have access to it.
Sure.
And, I mean, my personal feeling when it comes to diabetes is you can't see that I have diabetes.
No, yeah.
I look like anybody else. No, you know, there's nothing that...
healthy person,
Where someone with cancer, someone with HIV, you could see when someone was HIV positive and did not have access to medication. You could see what was happening. Whereas with us with diabetes, and perhaps maybe we're not the right people to be advocating for it. Maybe, I mean, yes, we are saying with the adequate medication, education and support, you can live a normal, happy life with diabetes, but is that what people relate to? I don't know.
All right. Well, our experts are still going to be in the loft. Get dialing like Mrs. Singh. If you want us to tackle any of your questions live on air, very interesting topic, and I think all of us are just dying for more information. So make sure you stick around. Let's check out Jenny in the kitchen.
Thank you so much, Bonang. Now, we are getting ready to wrap up these delicious rolls. Everything is looking fantastic. And this pork shoulder just looks absolutely delicious.
Nice and warm.
You know what this actually reminds me of? You know when you have really big family meals, like for Easters and Christmases and Pesachs and Rosh Hashanah, all the rest? You know, when the next day, when you have all of the leftovers and you put everything in a yummy roll, it looks like that.
Completely.
So how are we going to make them up? Are we just going to pile?
And then, you know, obviously it's about balance. You're not going to eat this every day. You're really going to like choose in your days.
Of course not. But today is one of those days that I definitely think we could be getting stuck into our pork shoulder roll.
Okay, so it's going to be like, let's do a little bit of a challenge here. Who makes the best one?
Look, I'm really good at Tetris, so...
And this is exactly it. This is Tetris by food.
Watch and learn. Okay.
Here's your teeny tiny tongs, and here's my teeny tiny tongs, and let's do this. So, as you know, we've got this beautiful maple syrup happening here. It is Woolworths summer flavour, so you're going to see it all over the place and all sorts of amazing things. And what I did here is just create some yummy pairings here that we can think about and use in different ways.
I am such a big fan of these pickles, gherkins.
These are, wait for it, sweet maple pickles.
Wow, look at that.
So there's all sorts of maple happening here. Can I give you some of the apples? I'm going to be
How
nice
many
and
do you
share.
take?
Well, I don't know.
Like
this is a competition over here, so...
Oh, yeah, we're doing a competition. I forgot.
I'm going to steal some of this bacon over here because it's delicious. It's actually a chipotle bacon, so we've got another fabulous summer flavour happening on there. Some of the dressing that you made here, which I tasted and is just fantastic.
Oh, did I succeed?
You succeeded. Just the perfect amount of sweetness, perfect amount of zestiness from the lemon, and it's delicious.
Okay, good. I like that because you didn't give me a lot of amazing direction as to how much of anything to put in. I just kind of went with a bit of flair.
Like talk, direct. I don't know. I can't do it all in one go. Okay, so...
Of course you can. Women are Wonder Woman. We can do whatever we want to do.
Okay, so like I said, earlier we did thin slices of apple so that when you kind of squish it all together, you can eat it and you get that beautiful crunch of the apple. And if you want to as well, you absolutely, definitely can do this in a bunless version. So you can just take the bun away and have all these yummy ingredients, and it's going to be just as fantastic.
I would definitely settle for the bunless version, but have a little look at that. You decide whose one looks more tasty. I would go with mine, just saying.
A little bit biased, I don't know.
Of course, you can build your own bun as well. All you need to do is visit our website, afternoonexpress.co.za, and we have the recipe there, as well as all of these tasty ingredients. Let's build more buns.
I'm going to keep going. Let's keep going.
Okay, we're going to take a quick break and build these buns. We'll be right back after this.
Groundbreaking treatment for eczema for adults.
Whether it's your first apartment in the city, a trendy suburban townhouse, or that dream family home on a golf estate, there's a home for everyone on private property.
Welcome back. You're still watching Afternoon Express live on SABC3, and we're talking all things diabetes. Now, Bridget, what I want to know, tell me a bit more about, Sweet Life magazine and the community that's involved in making that publication possible.
So one of the things we really love about Sweet Life is that it's not just the magazine, which comes out 4 times a year. We send it out for free to 15,000 people around South Africa through Dis-Chem stores and in local support groups and local pharmacies and doctors. If anyone wants free copies sent to them, they can email us on hello@sweetlifemag.co.za or check out our website on sweetlifemag.co.za. So we have the magazine, which is 4 times a year. We have a community blog, and people can write in with any questions or comments or requests for information. And then we have a Facebook page, Diabetic South Africans. And every week on Wednesdays at 8 o'clock, we have a diabetic chat where people
people can come and talk about anything
Amazing.
diabetes related with other people with diabetes, which is really lovely actually, because sometimes you feel like, I don't know if you guys do too, sometimes you feel like you're the only diabetic, so it's really lovely to have that.
Yeah.
And then
Well
a Twitter
done.
page as well.
That's awesome.
We also have Elna on the line. Hello, Elna. Welcome to Afternoon Express.
Hi there, and thanks for a lovely program.
Thank you so
Our
much,
pleasure.
Anna.
What's your question or comment?
Okay. Type 2 diabetes, if you don't look after it, can that turn into type 1?
Lynn?
No, type 2 diabetes remains type 2. But type 2 diabetes, and I think a lot of people are under the miscomprehension that type 2 diabetes will only require either diet and exercise or tablets. But diabetes type 2 is also destructive. In other words, the longer you have it, sometimes you can look after yourself very well, but it is also the condition of diabetes is by definition destructive. So eventually you may require insulin and by injection as well, but it does not turn into type 1. It still remains a type 2 diabetes.
All right, fantastic. We have another caller. Thank you so much for that, Elna. Lovely question. Michelle, how are you? Welcome to SABC3. You're live.
I am fine, thank you.
Thank you.
I just have a problem where I have the sore feet, which burns continuously. And I find if I eat anything that is spicy or chilies or something, it burns even more.
All right.
And when I found out about diabetes, when I went to the clinic, they just told you, this is a tablet you take. They didn't tell you anything about the sickness or whatever, so you've got to find out on your own.
Fantastic. Thank you so much for that, Michelle. I think, Lynn, first of all, what causes it? And then how does she fix it?
Diabetes type 2 is a condition of your arteries and your veins and your nerves. It progresses the longer you've had it, and also sometimes if you haven't really looked after it, you get something called a peripheral neuropathy, which means that these nerves of the legs are starting to degenerate a little bit. So initially you get intense pain. And that intense pain is often intensified at night. So I'm not sure whether the pain is at night, but and walking also causes cramping. So it is really a difficult thing to treat. But one of the things that does work, and the people have said this, and some people do, is you can just take something like ordinary Glad wrap.
Oh, wow.
And wrap it tightly around your feet. And by containing the nerve, it contains the pain. So that is one of the things that could possibly
Does
try.
she keep the Glad wrap around her feet or the whole day?
No, only at night.
Only at night.
You just
when
wrap
she
it
sleeps.
tightly at night, and it seems to contain the pain.
Okay.
But, there are things that if it gets really intense, then she obviously needs to have some neurologist look at it.
I mean, another thing Michelle mentioned is that when she eats spicy food, it's exacerbated. Why is that?
It's a difficult one to answer because, I mean, some people, all of us, as we get older, we get a little bit... There are certain things that we find we can't eat, that we've eaten before. And so
preservatives.
the preservatives and things, it gives you, those things can, because obviously, as we get older, we do become more sensitive to certain foods. I can't say that's exactly what would make it worse.
Fantastic.
But I think what that does touch on is that diabetes and the management and treatment, it's not a one-size-fits-all.
Yeah.
Each and every single person is completely individualized, and what works for one person might not work for another.
Got you.
So I think that's something that we also just need to keep in mind when it comes to how we manage and control.
Yeah, it just goes to show you that the treatment of it needs to be reinforced by a lot of information and constant conversation.
Yeah. And I mean, Carol, besides the International Diabetes Day, what else are Diabetes SA? What do you do on a yearly basis that, people that are watching can be involved in? How do we contact you?
They can contact the office, Diabetes SA in Cape Town. But we do awareness days. Nowadays we're running denim for diabetes days, and we do testing and even blood pressure testing.
Love that. Fantastic.
And of course, Diabetes SA needs funding.
Yes, they need funding. At the moment, we need funding. There isn't a walk this year, but anybody who wants to contribute are most welcome.
Yeah, I think it would be the best to go onto our website, www.diabetessa.org.za. and there's a lot of information there as to how you can get involved. And yes, we are, at this moment, we really would appreciate donations as to continue the work that we are doing.
Fantastic. Well, thank you so much to all our experts. I guess all of us learned so much. But make sure you join us again tomorrow for Afternoon Express, and tune in early, because during the first 15 minutes of the show, we chat to jazz house singer Monique Bingham. And in the kitchen, we make mango and maple glazed lamb chops. Talking about food, Jeannie's going to bring us our dessert. We're going to wrap things up. Well, no, not dessert, our main. What's up, babe? What's up, babe? What's up, babe?
Thank you so much, and thank you so much for watching. Until tomorrow, good afternoon, good evening, and happy eating. Ciao.
Wow, let's eat.
Coming up tomorrow on Afternoon Express, we take a look at South Africa's unique house music scene with veteran jazz singer Monique Bingham, as well as DJ Christos and Vinnie Da Vinci.
Another feel-good production.
Hi YouTubers, thank you so much for watching the show. Be sure to not miss another episode by clicking subscribe right over there. And we'll see you every day. Afternoon Express. Enjoy.